So it's not uncommon sometimes that we get those referrals and the referral says implant is loose, please evaluate and treat accordingly. And those implants may have been in function for 2, 3, 4, 5, 7 years, and so on and so forth. Usually, these are for patients who are good with their supportive care, they go to the hygiene visits. So that's rather alarming and surprising when we get those referrals to evaluate if the implant is loose. Out of all these referrals, I would probably say 8 out of 10, thankfully, it's just the crown that's loose. And that should be an easy fix. By the way, that should not be happening either. It should not be a routine thing, but if I had to choose between the two, I'd rather have a loose crown than a loose implant. A loose crown, it means you can most of the times tighten it back up, especially if it's connected via a screw to the actual implant. So this morning was one of these mornings between new patients. We had an evaluation for an existing patient that we were to evaluate for a loose implant. Thankfully, an X-ray here shows there's good bone all the way up to the platform of the implant, so it's rather unusual that this would be a failed implant. And upon clinical exam, the most telltale sign is when we get the crown in our hands and you click, 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 click in the patient's mouth. And this click, click shows the implant is solid and the crown is basically bouncing against that solid implant. It was an easy fix. Retrieve the crown, clean everything, clean the screw and all that, put it back on, retighten it, and put a filling material in the screw axis, hold properly. So that's one way to go about these things. Thankfully, it's not as common and we were able to fix this. So no need for new surgery, new grafts, new implants, and so on and so forth.